The Ministry of Health is yet again on the spot with revelations that the country lost 11 billion Kenya shillings in half a year in yet another scandal. Even after the installation of what was termed as tight procedures and waterproof IT system to secure the hard-earned deductions from Kenyan employees, the billions were still siphoned through fictitious surgeries and fraudulent claims by health facilities in the country.
Every month, money is quietly cut from millions of Kenyan salaries. Money meant for one thing: healthcare. Your healthcare. Your children's healthcare. But in 2024 and 2025, while ordinary Kenyans struggle to access basic treatment, a group of doctors, clinic directors, and even the very men appointed to protect the system were stealing it. Not in the millions, in the billions. This is the story of the biggest heist inside Kenya's health system. And this time, we know who did it. To understand the theft, you first need to understand what was being stolen from. In October 2024, the Kenyan government launched the Social Health Authority, SHA, to replace the old National Hospital Insurance Fund, NHIF. The idea was bold: universal health coverage for every Kenyan. A $104 billion system designed to ensure that no one dies because they can't afford a hospital. Every employed Kenyan was enrolled automatically. Deductions began immediately from payslips across the country. President Ruto called it a revolution in healthcare. The government called it a new dawn. But even before SHA was fully running, there was already a problem. In March 2025, Kenya's Auditor General, Nancy Gathungu, released a shocking report. The digital system that was supposed to run SHA, the platform handling billions of shillings in claims, had been procured illegally. No competitive bidding, no defined scope of work, no payment agreements, and most disturbing of all, the ownership of the entire system was left with a private contractor consortium, not with SHA itself. Kenya had spent over $104 billion building a health system and handed the keys to someone else. The stage was set for the biggest healthcare robbery in the country's history.
They told me that SHA doesn't work. I went to a government hospital. I also tried to use the SHA on weekend. They said it's not working. And I've paid for this SHA 7,600, which there's no value for my money.
Okay.
So saying that SHA works, it's a scam.
The fraud did not happen overnight. It was a system, a machine, and it ran at every level. Here is how it worked. Method 1, ghost hospitals. Clinics that existed only on paper. No patients, no doctors, no building. Just a license number and a bank account. These ghost facilities submitted claims to SHA for medical services that were never delivered. SHA paid them. In one case that shocked the entire country, investigators discovered that SHA had wired 19 million Kenyan shillings, nearly 20 million shillings, to Nyandiwa Dispensary in Homa Bay County. When journalists went to verify the facility, they found a thicket, a bush, not a hospital, a patch of land that had been abandoned for over 10 years. 20 million shillings sent to a bush. Method 2, upcoding. Real hospitals inflating their bills. A patient comes in for a simple outpatient visit, a consultation, a few tablets. The hospital bills SHA for full inpatient admission. Higher cost, more money. Method 3, fake surgeries. Hospitals submitted claims for surgeries that were never performed. Theater notes were missing. Documentation was forged. In maternity wards, facilities reported that every single delivery was a cesarean section, a far more expensive procedure. The World Health Organization recommends a C-section rate of 10 to 15%. Some of these hospitals were claiming 100%. Method 4. Healthcare workers as fake patients. In the most brazen cases, doctors and nurses registered themselves and their colleagues as patients, submitting false treatment claims under their own names. Between October 2024 and April 2025, just 6 months, this machine stole 11 billion reals from the Social Health Authority. 11 billion reals. While Kenyans lined up at hospitals and were turned away, while mothers delivered babies in corridors, while legitimate hospitals went unpaid for months, the money was going somewhere else. So who was behind all of this? The fraud operated at 2 levels. At the bottom, the clinics and health workers submitting the fake claims. At the top, the very officials who were supposed to stop them. Let's start at the bottom. In Kilifi County, Mtwapa Jumbo Jipya Medical Clinic was at the center of one of the first cases to reach court. The clinic's directors, Patrick Kanya and Faith Chepkurui, along with clinical officers Stephen Okinyi and Justine Baraka, nurse Pauline Wanjiro, and receptionist Naida Mbayo, all 6 were charged with falsifying medical records and submitting fraudulent claims worth over 2 million Kenya shillings between November 2024 and June 2025. They had created fake patient files, invented treatments, submitted them to SHA, and collected the money. On October 29, 2025, detectives arrested Robert Ingasira, the former acting chief executive officer of SHA itself. Let that sink in. The man who ran the organization being robbed was allegedly part of the robbery. Ingasira was arrested in Naivasha. He was charged with conspiracy to defraud, misappropriation of funds, abuse of office, and falsification of health information, specifically linked to fraudulent claims of 17.5 million Kenya shillings processed through Arch Prime Medical Clinic in Oyugis, Homa Bay County. Alongside him in the dock stood Arthur Otula, the clinic's owner, and Rosemary Daraja, a former nurse at the facility. Daraja, pleading for leniency in court, told the magistrate she was a mother to a 5-year-old child, unemployed and struggling. The court was unmoved. All accused were released on bail of 500,000 Kenya shillings each, pending trial. But Ingasira was not even the first SHA CEO to face charges. His predecessor, Elijah Washira, who led SHA before Ingasira, was also named in the same case. Washira had been suspended in November 2024 amid questions about his conduct. By the time Ingasira was in court, police were actively hunting Washira. A court summons was issued. He was required to appear on November 11, 2025. 2 consecutive CEOs of the Social Health Authority, both accused of stealing from it. As the arrests mounted and public anger grew, Health Cabinet Secretary Aden Duale went on the offensive. In August 2025, the Ministry of Health published a Kenya Gazette notice suspending 40 health facilities across 17 counties, facilities flagged by a forensic audit as having engaged in fraudulent claims. By later that month, 45 facilities had been suspended. 12 medics were suspended from SHA portal. Over 18 doctors and 22 clinicians were blocked from the system entirely. Duale called it what it was. "This is when the real theft took place," he said in an exclusive interview with the Daily Nation. "We will recover this from your reimbursement, since we have a very good program running." He warned that any healthcare provider whose information was used to defraud SHA would be held personally liable. Facilities, he said, would be surcharged, forced to repay money already stolen. By September 2025, the Directorate of Criminal Investigations had received 1,188 fraud files from SHA and the Kenya Medical Practitioners and Dentists Council. DCI Director Mohammed Amin confirmed that all of them were under active investigation. By October, 5 suspects were in custody, then 9, then more. As of January 2026, the Ministry of Health had confirmed that SHA lost Kenya shillings 11 billion in just 6 months, and the investigation was still expanding. Here is the question every Kenyan must ask. How did this happen? SHA's own digital system, the technology meant to verify every claim, every patient, every hospital, was built on an illegal procurement. A private consortium controlled it, and through it, ghost hospitals were licensed, fake patients were created, and billions disappeared. Civil society groups warned that the loopholes in SHA mirrored the very same scandal that plagued its predecessor, the NHIF. The names changed, the theft continued. While Kenyans paid into the system month after month, the system was being hollowed out from the inside by the people paid to protect it. And the most frightening part? The DCI still had over 1,100 files under investigation, hundreds of facilities, hundreds of suspects. The arrests you have heard about tonight are just the beginning. Robert Ngasira and his co-accused have pleaded not guilty. The cases are ongoing in Kenyan courts. Elijah Wachira, the former CEO, still being pursued by police as of the time of this video, has not been convicted of any crime. But the numbers do not lie. 11 billion, 6 months, ghost hospitals, fake surgeries, 2 CEOs under investigation. This was not a mistake. This was not a clerical error. This was a heist, planned, organized, and executed inside the very system built to protect Kenya's most vulnerable. And as long as Kenyans refuse to look away, those responsible will have nowhere to hide. If this video opened your eyes, share it. Subscribe to Kenya Documents for more investigative stories that the mainstream media won't tell you.